Professor Moon, shoulder instability is quite a common subject in shoulder nowadays in young people. So how do we go about it? How do we classify shoulder instability?
Yes, we should divide it into two parts. The one is the etiology, the other is directional point.
Okay.
When we think about etiology, we can divide it into traumatic or atraumatic.
Okay.
And additionally, when you think about the directional point, we can divide into anterior, posterior, inferior, or combined multidirectional.
Okay. Which instability is more common, or is it few people are more vulnerable to shoulder instability?
Yes, we usually enjoy dividing into traumatic or atraumatic, but traumatic is more common. However, it is very hard to define clear traumatic instability or clear non-traumatic instability. It means lots of sports players, they do vigorous sports. However, only some portion of the player, they are having the shoulder instability. It means even the high school students, only few high school students have shoulder instability. It means some player or some student or some young boy or young lady, when they have very lax joint or very vulnerable to instability, then they are easily going to the shoulder traumatic instability when they do sports activity. Okay. So our concept is switch before and now.
Okay. Why is it important to define traumatic shoulder instability versus traumatic shoulder instability?
Yes. Before we divide into traumatic and atraumatic instability, you should divide it into laxity or instability.
Okay.
And laxity is regarded as very unstable shoulder without any symptom. If the patient do not have any complaint, it's laxity.
Okay.
And if patient complain the pain or discomfort with instability, we regard it as instability.
Okay.
And then the instability can divide into atraumatic and traumatic. Traumatic instability is the patient should have clear history of trauma, such as fall from the height, or the lose their foot and the step on the hand, or some direct contact, or some kind of convulsion when the patient has epilepsy. Or other patient is on the other hand, if the patient has an atraumatic instability, the patient does not have clear history of trauma. They just feeling of instability when they lift up a little bit of heavy material, or if the symptom is gradually aggravate after the event was happened. First event was happened.